Hello, my name is Tony Lee, and today I will be presenting my PowerPoint on heart attack. So, what is a heart attack? It's when the flow of oxygen-rich blood goes to a section of the heart muscles when that suddenly becomes blocked and the heart can't get any oxygen. If the blood flow isn't restored quickly, the section of that heart muscle begins to die. Heart attacks are a leading killer of both men and women in the United States. The medical term for heart attack is called myocardial infarction. Myo meaning muscles, cardio meaning heart, and infarction meaning the death of tissue due to a lack of blood supply. So what happens during a heart attack? Heart attack occurs mostly because of a coronary artery disease. The coronary arteries is when plaque builds up to block the arteries. In order for the heart to get any oxygen, the coronary artery needs to apply to the heart. If there is plaque blocking those arteries, it causes a blood clot which leads to a heart attack. As you can see in picture A right here, it shows where the coronary artery is. If you look over to the right in picture B, the yellow stuff, which is the plaque building up in the arteries, and above that on the plaque, it shows an arrow which is the blood flow going down, but because of it reversing back up, because of the blood clot, the blood flows can't get down to the artery, which leads to down on the bottom of the picture to a dead heart muscles. So, what are the symptoms of having a heart attack? You may feel discomfort, pressure, heaviness, or pain in the chest, arm, or below the breastbone. You may also feel discomfort to the back, to the jaw, throat, or arm. You may also feel like you're having a heartburn, you're sweating, you feel nausea, feel like you want to vomit, or you feel dizzy. You may also feel extreme weakness, anxiety, or shortness of breath. On top of that, you may also feel rapid or irregular heartbeats. So there are tests and diagnoses you can go through to see if your signs and symptoms indicate a heart attack. The electrocardiogram, ECG, is a test to diagnose a heart attack records the electrical activity of your heart via electrodes attached to your skin. If you look at that picture on the bottom right here, this is a picture of an ECG. And the top right here is an example of an electro wave. Certain heart enzymes is slowly leaking into your blood if your heart has been damaged by a heart attack. Emergency rooms, doctors will take samples of your blood to test for the presence of those enzymes. So there are treatments and drugs for a heart attack. If you're having a heart attack and that's not treated, it may worsen in the future. Some of the medication to treat a heart attack are aspirin, nitroglycerin, beta blockers, and ACE inhibitors. Other than medications, you can undergo surgeries. Two of the surgeries you can undergo are coronary angioplasty and stenting and coronary artery bypass surgery. A coronary angioplasty and stenting is when a doctor inserts a thin tube that's passed down through to your arteries. If you look over to the picture of the three arteries right here, in the first picture, it shows a tube with a stenting and a balloon inserted down to the arteries. In the second artery picture, it shows that the balloon is inflated, causing the plaque to stretch and the stenting to stretch. In the third picture, when the balloon is deflated, the stenting is leaving in the arteries, causing the plaque not to close up to each other, causing the blood flow to go down to the arteries. The second surgery you can undergo is called a coronary artery bypass. That's when a doctor performs emergency bypass surgery at the time of a heart attack. Bypass surgeries involve sewing veins or arteries in place beyond a blocked or narrow coronary artery, allowing blood flows to the heart to bypass a narrow section. If you look at the picture of a heart, right here is a saphenous vein from the leg. They attach it to the aorta and down to the arteries so the blood can bypass the plaque that's built up in this artery right here, so it could just go down this one right here. So lifestyles and home remedies. Your lifestyle affects your heart health. With the following, you can prevent you from having a heart attack and also recover from one. You can avoid smoking. Control your blood pressure. Have your doctor monitor your blood pressure. Get regular medical checkup. Maintain a healthy weight, exercise, and eat healthy. Control your stress. Take a walk, relax, meditate, get away from that stress for a while. If you drink a lot of alcohol, maybe you want to reduce it to 1 or 2 cans a day. Thank you for your time, and if you have any questions, feel free to send me an email.